By participating in research, you help us doctors and scientists answer the big question. Your involvement helps us to come up with real-world solutions to make healthcare better for everyone. Next, I'd like to invite Dr. Jen Smith. Dr. Jen Smith is a genetic epidemiologist. Essentially, she studies how genetics and environmental factors influence the course of disease. She's going to tell us about how we put Precision Health puts diversity in the forefront of our research.
Thank you, Jen.
Hey everyone, thank you so much for being here and for being part of Michigan Precision Health. I'm going to talk a little bit about participant diversity and especially how that pertains to our genomics initiatives. So first I want to just take a minute to think about what we mean when we talk about diversity in our study samples. So there are lots of different ways that humans and our patients at Michigan Medicine differ from each other. And so that can be thinking about things like age, sex, race and ethnicity, culture, language, immigrant status. Also in terms of whether people are affluent or have more disadvantage and the diseases that they have. And participant diversity really is critical for our mission in precision health. And first, that's because we want to help people, right? And we don't want to help, just certain groups of people. We want to be able to help every patient who walks in our door. And so we can't have a one-size-fits-all model to medicine. And so it's important for us to understand all the populations. Second, we really want to understand biology, right? And so learning about different genetic ancestries can help inform biology. So for example, an example from genetics research is that there's a protein called myosin-binding protein C3. And people who have South Asian ancestry can have a high risk of heart failure due to a specific genetic variation that population is more likely to carry, right? And so for people who have South Asian ancestry, it might be really important for us to test for that genetic variant. And learning about that protein, the genetic variants in it, actually can help inform the biology of heart failure and can be useful to everyone. So here at University of Michigan, we have a biobank called the Michigan Genomics Initiative. It started about 10 years ago now. And to be a part of the biobank, we ask participants to fill out surveys. We link to their health records and we ask them to provide a genetic sample like blood or saliva, and many of you have probably done this, so thank you for that. We're happy to say that now we have over 100,000 participants who've enrolled in MGI, and that's been fantastic. And MGI actually started with enrolling from our surgery department, and that means that a lot of the participants that were coming in tended to be older, maybe sicker. They tended to have more European ancestry or be self-reported to be white. And they might also have been more affluent than the general Michigan population or the population of the US. And so we realized that we wanted to kind of take a diversity effort in that sense to really expand our participants in MGI. And one of the ways that we've done that is through the MyPart study. It's called Michigan and You, Partnering to Advance Research Together. And through this initiative, you can see that over in, if you can see my pointer, but over in the left side of the graph in blue, you can see the age distribution of MGI. And so it tends to be a little bit older, between ages about 50 and 80. That we have 14% of participants who are not self-reported white, and that we have about 3% Hispanic and Latino. But through the MyPart study, that is in yellow on the right-hand side. We've been enrolling mostly younger participants between the ages of about 18 and 50. And almost 40% of our participants are self-reported African American, Asian, Native American, multiracial, and we also have a higher proportion of Latinos. So we're trying to, we think we've been able to sort of boost the diversity of MGI this way. And the MyPart study in precision health has also made it possible for researchers to focus on specific health concerns that are important to Michigan. And so, for example, Metro Detroit is home to the largest and most visible Arab and Middle Eastern North African, or MENA, community in the United States. And Arab and MENA are at increased risk for cardiometabolic health problems. So that's like cardiovascular disease, high blood pressure, diabetes, and that's true, both here in Michigan, but also abroad. And some of the risk factors may be specific to that ethnicity, and they could be things related to diet, lifestyle, environment, and also some of the genetic factors that could be related to ancestry. And so one example is people from the Middle East may practice hookah smoking. About 50% of young adults in that population may practice hookah, but we don't know a lot about how that affects their cardiovascular disease risk later in life. So these are specific research questions for that population. And so we have a multidisciplinary team that has worked with Precision Health to help us start to examine the social, behavioral, and genetic predictors of cardiometabolic disease in that population. We've had challenges, and we knew we would have challenges recruiting the Middle Eastern North African population. So one that kind of hit right off the bat was locating potential participants, because in the US Census, there's not an indicator for whether someone is Middle Eastern, for example. Most people will choose white. And so when we look within our Michigan Medicine participants, we don't know who might be Middle Eastern. We've actually worked to change that at Michigan Medicine, and now there is an indicator for Middle Eastern. If somebody wants to report that that's what they are, they can choose that on their MyChart. Another thing that we knew would be difficult is building trust in the community. So communities that aren't, sort of the majority might tend to shy away from research or not trust research, especially people who are older in this community. And so what we've done is we've worked with a lot of community partners to help build that trust. So one of the first groups that we started working with was Access, the Arab Community Center for Economic and Social Services. And we've learned a lot from this partnership. We've done focus groups and lunch and learns with their staff and with their leadership to really understand the health needs of the community better, to build trust, and to get feedback on how we might do things better. And one of the things that we've learned there is that the language barriers can be really substantial. And so in the future, we're trying to get our MyPart survey translated into Arabic, and we think within hopefully another year we'll be able to do that, and we think that'll really help boost participation. Another amazing partnership has been the University of Michigan Dearborn, and I want to give a special thanks to Dorina Mehdi, who's here, who is the president of the student government there, and has really opened up a lot of doors for us to come onto campus and talk about our research and recruit people. We also were able to meet student recruiters. So we have hired onto our MyPart team one of the students that we met there, and that's been fantastic. And we've also partnered with local clinics. So for example, at the Metro Detroit Endocrinology Center, where we've been enrolling patients with a lot of different diversity, different racial, ethnic backgrounds, but that are more disadvantaged. And so now I'm just going to show you a little bit about the people that we're enrolling at these sites. So at Access, we've enrolled 109 participants, and the vast majority in dark blue here are MENA. At the University of Michigan, we have over 250 people that we've been able to enroll there. And you can see there's a pretty good mix of people. We've got about 25% MENA, about 30% Asian, and that's mostly from South Asia, which we definitely need representation in MGI, so that's been great. At the Endocrinology Center, again, we have a lot of diversity there. And so these partnerships, along with some other initiatives that we've been doing, have allowed us to enroll almost 400 MENA participants right now. And our next step is we've been working on applying for federal funding to really expand that recruitment and that effort, increase enrollment to about 2,000 MENA, and then also translate the survey into Arabic and allow us to do some really great work on those cardiovascular risk factors. I'm going to say I didn't have time to talk about a lot of the other partnerships we have, but MGI is partnering a lot even with investigators here at the University of Michigan. So one of our newest partnership is with, it's called the 360X study, and it's a study of heart disease in African Americans. And so we're recruiting along with 360X. We are in the process of translating our surveys to Spanish so that we are able to reach better the Latinx community. And we also have made our enrollment faster and easier, so we're trying to break down some of the barriers to all the different populations that we want to be a part of and want to work with. And so I want to thank the cohort development team, Precision Health, all of our amazing community partners, a lot of whom are here, have been very supportive, and we also have other community partners I didn't have a chance to talk about, and we thank all of them, and I thank you for being a part of this research too.